Hello, very warm welcome. You're joining us here at Hyde Park on Derana 24. Today we will explore the intersection between health innovation and personal empowerment through the eyes of a leading expert in medicine, a specialist in cardiovascular care, a doctor whose origins, whose roots are in Sri Lanka but lives today in the United States. A very warm welcome to Dr. Radha Gopalan. Ayubowan.
Ayubowan.
Vanakkam.
Vanakkam.
And a very warm welcome to you.
Thank you.
From Jaffna, Sri Lanka to the United States, Arizona.
Yes.
How long has it been?
35 years.
You grew up in Sri Lanka, that means?
I grew up in Sri Lanka. And I left when I was 27 years old.
Okay. So you knew Sri Lanka well when you left.
Yes. It's truly a pleasure to be back here.
How long do you travel here regularly, or is this after a long...
Since I left, this is the first time I've come back.
Oh, very warm welcome. Very warm welcome to your motherland.
Thank you.
It's amazing to have you, of course, from northern Sri Lanka. And I think you've traveled, you've been away during a crucial time, a difficult time in Sri Lanka's history too. Yeah. But of course, you're doing great across the world, and we're very happy to talk about your work. You also, you're the visionary founder of a Healthy Human and the Healthy Human Foundation, the Healthy Human Institution. Let's talk about it. What's this you're doing with Eastern and Western medicine? What inspired you to do that?
What inspired me to do is the Western medicine. When I practiced, and as we practice it currently, it actually disables patients. And it's a controversial statement. In a sense, how can Western medicine that helps a lot of people be a disabling agent or a tool? When it comes to acute disease, Western medicine is perfect. It really saves life. But if you look at the chronic disease, it disables. And the reason it disables is not because of the medicine is wrong. We don't combine lifestyle modification and personal empowerment of the patient along with the medications. So it's like when someone cannot walk, you give a crutch and you leave it at that, they are permanently disabled. They depend on that crutch for the rest of their life. On the other hand, when we give the crutch, and if we also train them subsequently how to walk without the crutch, then they will be able to get rid of the crutch. I realized when I was treating heart transplant patients and cardiac patients, in the United States, irrespective of having the latest technologies and the best health care, in quotes, these patients keep coming back. No matter how much we help them, they kept coming back. There's something missing. And what is missing is their personal empowerment. We do not provide that service to the patients. We leave them with medication.
I'm confused.
Yes.
You are a specialist in cardiovascular transplant,
yes,
and medical acupuncturist. You say Western medicine will disable a person. I'm sorry if you mentioned that it's not going to really take very good care of, give you holistic care.
Correct.
But you specialize in Western medicine, and you talk about acute and chronic disease. And how do you link this to Ayurveda? This doesn't go hand in hand.
Exactly. So I practice Western medicine. There's nothing wrong with Western medicine. It's insufficient to make one healthy. We need to combine tools that really and actually makes people healthy. And that starts with health education. And if you look at the world, and especially in the United States, and even when I grew up here, there is no health education in schools. There's no health education in colleges. The education that is available doesn't truly speak about health itself. It speaks about disease and how to prevent diseases, such as, for example, in the United States, we educate our kids on sexually transmitted diseases to prevent them from being contracted with diseases that they are not aware of. But true health and what health means and are not really taught at schools. So most of my patients, and I'm sure that most of the doctors will agree, that they learn about health from how they grew up, from their parents. And if the parents are not taught about it, it's not handed down the right way to the children.
And how do you blend Ayurveda, Western medicine, and Ayurveda, the Eastern practice of medicine? Is this because of your roots in Sri Lanka, or did you study Ayurveda after you graduated med school?
It's because of my roots in Sri Lanka. And I studied acupuncture here under Dr. Anton Jayasuriya at the Kalabovila Hospital in Colombo when I was in med school.
Before we answer that question, let's go to where you studied medicine here in Sri Lanka, or whether you studied in the United States.
I started my med school here in Sri Lanka, and then when it was interrupted for a brief period, I started studying acupuncture with Anton Jayasuriya. That's where I was first exposed to the Chinese philosophy of medicine, even though I was exposed to the Hindu philosophy of medicine, such as Ayurveda, yogic way of living, when I was a child and grew up as a teenager practicing these. Subsequently, I was in awe of Western medicine, and I went to med school. I wanted to be like my uncle, so I wanted to become a doctor, and joined and started med school. During the time, it's a funny story that when I heard about acupuncture, I joined skeptically to find out how acupuncture works, because I did not understand how can bare needles inserted into a human body can heal a person, because I was at a stage when I was thinking science, logic, and Western medicine is the only medicine that can save people's life.
But does acupuncture really heal?
It does in 60% of the population.
I don't have experience with that, so I ask you.
So the acupuncture functions at a different level than Western medicine. See, if you look at the human body, when you develop biochemical and structural abnormalities, one will be diagnosed, and along with the symptoms, you will be diagnosed with a disease. So you go to a Western doctor, a modern doctor like me, come to me and you give me symptoms. If I cannot find any abnormalities by doing tests, I really don't have any tools to prescribe a medicine for you.
Right.
I don't have anything. Whereas the acupuncture and homeopathy and Ayurveda is a way of life for health. But homeopathy and acupuncture, they're actual treatments. They work at the energetic level of the human being. A disease, at the time symptoms originate, is not when it started. We have, in science, we know that the atherosclerotic process of cardiovascular disease, these plaques are found in 10-year-old children by autopsy studies.
Really?
So these abnormal plaques are being formed during the growth phase of the children, but we don't know anything about it. So the foundation for later disease is already being laid in at a younger age.
At just 10 years old?
At 10 years old.
So is there anything you can do at that age?
Education of the children and the healthy lifestyle, and education about diets, exercise, and a change in lifestyle will change the way these foundations are laid in people, so that the experience of disease is pushed back to latter ages. You know, in medicine we talk about health span and lifespan. Lifespan is how long you live, health span is how well you live. But the important thing is to improve how well you live to however long you live. That's the important
So improve your lifestyle, improve your living standards, but how do you really reconcile these seemingly different philosophies in your practice, really?
Traditionally, Eastern and Western medicine was considered as opposing each other. And if you actually talk to an Eastern practitioner, they will despise Western medicine. You talk to Western doctors like us, we will think that Eastern medicine is quackery and has no valid foundation. But that's because we are looking at it from the prism. When you look at Eastern medicine from a Western prism, that's what it looks like. When you look at Western medicine through the Eastern prism, it looks like it's hurting people. But they both have their own place. The Eastern medicine does not treat disease, and Western medicine does not improve health.
So Eastern medicine does not treat the disease and Western medicine does not improve health.
Correct.
So here you are combining both of them, a concussion of them. So how have you, what kind of an impact have you made in the US?
It's significant impact. What we have started doing at the institution I practice at is gain some roots into combining the two, such as acupuncture, massage therapy, in addition to providing excellent modern medical care, such as transplant surgery and other interventions. So when you combine the two, including what we call prehab. Prehab means physical exercise before someone goes for a surgery, so that the ability for them to recover after the surgery is much improved. So we include prehab, massage, spiritual therapy, which is involving pastors and other religious leaders to engage the entire spectrum of the human being to be able to be successful for whatever surgery the patient is.
That's interesting coming from a Western doctor. You talk about the spirit. What kind of a role does spirituality or human spirit play in, let's talk about a cardiovascular transplant. We don't hear this in Western medicine or practice.
Yeah. The spirit, in my personal opinion, spirit is the most important powerful tool that a human being has to exercise. That means that the human being should be able to be in contact with their own spirit, which comes through being mindful. And mindfulness comes from practices such as meditation and other Chinese practices that can improve the mindfulness. In Chinese philosophy, they believe that the human body is an exact duplicate of the universe. In other words, they call it microcosm. The universe is called macrocosm, and the human body functions along the ways of the nature. So there is the function of the human body is just like the nature. So the Chinese philosophy aligns the function of human body and dysfunction of the human body like how it should be in nature. So the idea is balance. Nature is about balance. You have day and night, up and down, which is the yin-yang theory of Chinese philosophy. So even modern medicine acknowledges the foundation of modern physiology is called homeostasis, which is balance. So when the body is imbalanced, it results in disease. When the body is balanced, the disease is diminished.
So let's go back to the story of a 10-year-old boy or a girl, a child, who could have early signs of cardiovascular disease. Where do we start? What kind of a healthy, balanced lifestyle would you recommend a young child?
For the young child, the first thing is to understand and change the lifestyle. The lifestyle comes in different shapes. One of them is the food we eat, right? That's one. So you change the food and the recommendations that are related to cardiovascular system and organize the food to suit and make sure that it does not promote atherosclerotic disease. That's one. The second, I think it's not only the children, even the parents need to be educated. I think the entire population need to be educated about what we consume, what interactions we have. The second is to be active. We now live in a world where activity is diminishing. Movement is an extremely important aspect of health and longevity. So without moving, you become unhealthy. So exercise becomes another component of a healthy lifestyle. So the food, movement, sleep, adequate sleep. We also live in a world where we are exposed to blue lights, social other triggers that are exciting, and most of the population is constantly interacting with disruptors of sleep, and they don't get a full restorative sleep at night. For example, the recommendation is one should turn off blue light minimum 1 hour before going to sleep, ideally 3 hours before going to sleep.
Well, that's amazing. I think we'll have to take a short break here at Hyde Park. We're in conversation with Dr. Radha Gopalan, an individual, a specialist in heart health cardiologist, and his unique blend of Eastern and Western medicine has transformed the way we look at human health. We'll come back after this short break. Stay with us. A very warm welcome. Welcome back. You're joining us at Hyde Park, and we're in conversation with Dr. Radha Gopalan, the visionary founder of Healthy Human and the Healthy Human Foundation, which focuses on educating individuals on how you can become healers of your own body. Dr. Gopalan, you have authored 2 books. I have them here, if I may. The Second Opinion, 8 Deadly Diseases, and Battling Pandemics, Epidemics, and Diseases. You're talking about a holistic approach here. And more than 100 articles, why an artificial heart, preemptive use of perioperative, I can't read the rest of it, I don't understand, utilization of leadless pacemaker. Well, I mean, a lot of technical words here, but at the same time, you're talking about how we can just get closer to our roots, nature, have a balanced lifestyle, and heal our own bodies. Earlier, before we went to the break, you spoke about how disruptive sleep patterns could really affect lifestyle. So let's continue from there. But also, I'd like you to talk about your books, what they reveal, what they share with the rest of the world, and whether it's possible, even at age 50 or 60, if you really have risks, to reverse cardiovascular disease.
Absolutely. So let me start with, I love Western medicine. I still practice Western medicine. And through that practice is the recognition that we are not doing enough with Western medicine. If we leave the patients with Western medicine, it can be quite disabling, as I mentioned before. It has to be combined with other empowering efforts, either by the country or locally by the states or physicians and especially patients, to recognize that other aspects of health, not disease. Western medicine takes care of disease, but health is only generated by the individual. It's something that all ancient philosophies have well recognized in the past, that you take medications, but medications are like band-aids. They help you, and if you continue to use them, you will continue to have the disease, but temper the disease from giving you symptoms or progressing further, but that doesn't necessarily mean you are improving your health. Having said that, the reason that I wrote this book is Second Opinion is I grew up in Ayurvedic tradition. I practiced yoga on a daily basis. I meditated, and I became a cardiologist, and I was a young director of a heart transplant program in Pennsylvania, and still at the age of 44 I had my heart attack. I did not consume alcohol, I did not smoke, I exercised every day.
You had a heart attack at the age 44.
That's when I realized you can have Eastern medicine, you can have Western medicine. Neither could help you if you are not helping yourself.
So how do you help yourself?
To recognize the change in health within yourself. That is where this, it's so
I think the camera would like to capture it this way. Yes.
Yeah. So this is where I kind of wrote down that it's not what you do to be healthy, it's who you are being. That's more important than what you do. And if you really look at it, the motivation and intention has to be present for continued efforts to be healthy. What missed in my life at that time, even though I was running and exercising daily, I practiced yoga, I meditated. All of these, if you look at in this world, currently are touted as something that helps prevent diseases. That may be true. Nevertheless, what is more important is how much of a human spirit and your own power is being affected by your life. How are you handling your emotions? How are you handling your mental status? How is the stress? You know, stress is the biggest cause of inflammation in the body. Inflammation is now considered the mother of all diseases. Most of the diseases seem to spring from underlying inflammation in the body. We live in a very toxic world, and how do you eliminate those? Is it enough just to meditate, exercise, and if you don't eat the right food, if you don't eat, avoid stress or learn coping skills to minimize stress, you may still end up having a disease or a heart attack. When I had my heart attack, I sought Western medical treatment because that's the only answer to that. So Western medicine excels in acute problems like heart attack.
So a disease, you treat it with Western medicine.
Correct. But if you looked at it, what led up to that heart attack is something that was brewing in me for a long time.
You're not taking care of your spirit.
That's a lifestyle.
In your words.
Correct. So even though I used Eastern medicine that may have prevented me, the heart attack wasn't catastrophic at the time I had it because of the efforts I was doing. Exercise, not drinking, not smoking, and meditating, all of that helped me. Without that, I may have had a heart attack even before age 44. And I did not have any diagnosis at that time, high blood pressure or diabetes. These are considered predisposing factors for cardiovascular disease.
And you had no idea or clue that this was coming?
No.
And what did you do? How did you change your lifestyle?
It changed my lifestyle completely. I started focusing on human spirit. How I am being, how I am reacting, physically, mentally, and emotionally. This gave rise to the concept of the internal self. What we project to the outside world is a mix of primal being and our superego, so to speak, how we are conditioned, how we should conduct ourselves. It's a mixture of two, then we project to the world, which is the personality. And if you look at this, in this book, I write about 8 deadly diseases, but more importantly, the internal dialogue. There's something that's going on in our mind all the time. For example, we found out in patients who have liver disease, I'm a heart transplant cardiologist, most of the patients who require liver transplant come to us for cardiac clearance before they go for the surgery. We have to clear them that they are fit for the liver surgery. As I observe these patients, you tend to recognize a pattern of the personalities that has liver disease. And those patients tend to be unable to feel the world. In other words, they don't want to face the world. They don't want to interact with people. And they subsequently succumb to addiction, usually alcohol or something else, to distract themselves from facing the problems of the world. That was a very common occurrence in those patients when you see them. So there's an internal dialogue in them saying, I don't want to face the world. So that is way more powerful than anything else we do. So you look at that, some people call it chicken little, I call it the roommate or the internal dialogue. We are always chattering within ourselves. What you tell yourself is extremely important in the outcomes of any disease, or how you are going to control. Interesting
that Western medicine, a practitioner is talking about this. We hear about law of attraction, or we talk about self-empowerment, make yourself feel good, start your day, giving positive energy to yourself, your being. So what changes would you recommend today to someone who's listening to us? How would you talk to them? How would you ask them to talk to themselves to improve their health from where they are today?
Yeah. The first thing is to understand what health is. If you look at the dictionary definition of health, it would tell it's a state of complete physical, mental, and social well-being, not merely the absence of disease. So that is what the definition of health. The only problem is what is well-being is something that is, if you look at the dictionary definition of well-being, it will refer you back to the definition of health. So you are going back between the two. There is no practical, it's not very practical. The practical way of thinking about health is an ability to balance. It's a state of balance and adaptability to external triggers, whether it is stress from work or other environmental changes, cold weather, hot weather, whatever it is, it's an ability to balance is a much more of a practical definition of health. That's the first thing that we need to empower people with, to understand. Once you understand that, the second thing I have done, and we encourage patients at my institution to do, is to become mindful. Because changes in health can be recognized. That's something that a lot of people don't know. They wait for the symptoms to happen, but you can recognize change in your health way before symptoms happen. So teach patients or even the general population, healthy people, about how to recognize when their health changes. Because earlier recognition they have, the easier it is to take care of and take action to mitigate development of disease. That is more important. And the third part is health is renewable. A lot of people don't know. You can renew your own health. You asked, even a 50-year-old, can they change by adapting different lifestyles? Absolutely. Dean Ornish in the United States worked on cardiovascular patients and changed the diet. And there is evidence that if you change your diet, he proposed full vegan diet. And they did coronary angiogram, pictures of the blood vessels that supply the heart, and proved that there was regression of plaques. So there are efforts that can be done. Even if you have a disease, you can be healthy. A lot of people think that once they have disease, they are sick and they are condemned to live with the disease. That is not true. You can change the way you live.
You can reverse.
You can reverse. After my heart attack, I changed the way I look at myself. So I recognized Eastern medicine, Western medicine is not enough. I need to empower myself with other things, especially more of how to cope with stress, how to reduce stress, how to have restful sleep, how to continue to move, how to eat right, how to challenge toxic emotions and triggers. All of those combined can help regress the existing disease, or at least temper the progression of the disease.
Let's come to Sri Lanka here. Do you think we have enough medical education, or do you think we should rethink how we educate or bring up medical practitioners in Sri Lanka, especially a place where Sri Lanka is home to, whether it's Ayurveda or the Eastern philosophies of medicine, primarily influenced by Western medicine today? Do you think we should rethink our education, medical education to begin with?
I don't, let me tell you, the Sri Lankan people are inherently much more healthier than the people in the United States that I see. And the reason being, there is a great influence of health-related lifestyle already in place. And you have brilliant medical experts in this country. They are being drained, they are leaving sometimes. We have that problem in Sri Lanka, but we have brilliant doctors. So I don't see this as an inferior place where we need to improve anything. And I think the medical education is excellent. I went to med school here. I learned everything, the fundamentals of medicine here. It imparted me with much better understanding of Western medicine and a critical thinking that's required. What is needed is adding health education. So the medical education is excellent in its own. We produce one of the best doctors. The the health education is where we can make a lot of improvement to the population.
So you talk about preventative care, you talk about integrated access to preventative care. How do we make that happen in Sri Lanka, in your opinion? And I wanted to interrupt you earlier. This is the first time I'm hearing on my show someone practicing in the United States talking about Sri Lanka highly. So it's great to have you back in Sri Lanka once again and to really appreciate where you began, your roots, so to speak. So how do we really look at incorporating preventative care to understand a disease, or whether early detection to prevent or to really give holistic care? And I like to hear more about taking care of your spirit. We have meditation here. We have yoga, Ayurveda. And now you spoke about speak to yourself. You travel across the world talking about how it's important to be a healthy human before you do business or earn money. Yeah. So let's talk about it.
Yeah, it's very important in the sense the health is important for the optimal function of the human mind. Mm-hmm. Human mind is brilliant in bringing out results. For optimal results, one should be optimally healthy. So therefore, I think it's very important to have health in the forefront of any efforts you do in life. When it comes to optimal health, the engagement of the spirit, as I mentioned before, is very important. How do you engage the spirit? As we live in a world with distractions, your focus is being separated from the own spirit. Spirit is the source of energy. If you look at health, in the financial world, the currency of wealth is money. Mm. You look at health, we don't have a currency that is widely talked about. But in essence, energy, how you feel, how you have endurance, and your energy. A lot of people complain about, I feel lack of energy, I'm fatigued and I'm tired. But they're talking about lacking that currency of health. So when you feel that way, you're losing the currency of health, which is energy. And it's important to recognize energy is the currency of health. So practice in lifestyle, anything that puts energy into yourself is an asset, it's a health asset. Anything that takes energy out of you is a health liability. So the same as in the financial world, we should be able to balance the assets and liabilities of health. If we master that and develop mindfulness to be able to recognize the change in health, we have at least conquered 50% of what is required to be healthy.
Right, I think on that note, it's time we take a short break. We're in conversation with Dr. Radha Gopalan, who talks about how you are the medicine. We'll be right back after this short break. To stay with us. Welcome back. We are in conversation with founder of the Healthy Human Institute in Phoenix in the United States, Dr. Radha Gopalan, whose roots are here in Sri Lanka. Dr. Gopalan, let me very quickly talk about Sri Lanka and the global health impact. You speak about post-pandemic health. Let's look at all this now. How in Sri Lanka, preventative care, or even when we talk about global trends and practices, how we can really relate to innovations, new trends, and what we can really replicate here in Sri Lanka to look at preventative care, at the same time take care of ourselves and create a market for wellness, happiness, and preventative care here in Sri Lanka with a combination of Ayurveda, acupuncture you speak of very highly, and Western medicine as you practice.
Thank you. So looking at this, the last time I looked at some of the data that belongs to Sri Lanka, the out-of-pocket expense in Sri Lanka is very, very high compared to the United States. Mm-hmm. In the United States, about 10%, and here it's about 40%. What does that do? Is makes people financially crippled. If anyone develops a disease and they have to pay out of pocket more, for some reason that seems to be high. So one of the ways that we could reduce and improve the well-being of the families is to try to reduce the out-of-pocket expense. But more importantly, the global impact in Sri Lanka, I think in any nation, is basic health education, starting at schools, to create a curriculum that truly makes the children understand what health is. Then they become adults. They begin to utilize the tools they learned in school. Healthy behaviors, what health really means. It's not the absence of disease. You ask any young people in the United States, you ask any young person, including my own son, I ask him, are you healthy? And he says, yeah, I don't have any problem, I don't have any symptoms, I'm healthy. Little does he know that the foundation of disease is being already laid in him, but he hasn't felt it yet. So in order to prevent that, early health education is the single most intervention that any country can do. Solely relying on medical treatments and continue to improving medical treatment while it's essential is not the complete answer. We have to engage the population, not just the system handing over tools, but also empowering the patients so that both in combination have profound results. Sri Lanka already is rich in traditional medicines, and it has excellent Western medical doctors. So you already have the required resources. It's just a matter of figuring out how can we combine the two and provide the service that's required. Western medicine to take care of the disease, Eastern medicine to empower and maintain health. In combination, both of them can work synchronously with the power of the spirit of the human being. It will be phenomenal results.
You say Sri Lanka has everything we want, just put them together, make it happen. But what do you expect, let's say, from the Sri Lankan government to help Sri Lanka put our resources together to make this happen? Is it possible for Sri Lanka to be a regional hub maybe for holistic healthcare and support more people, be closer to themselves and be their own medicine, as you say?
In my personal opinion, Sri Lanka has the potential to become a regional hub because we are a nation that has the tools, the resources that's required. You have the spiritual fundamentals of the population. You have the brilliant minds of the Western doctors, and you have the brilliance of Eastern physicians. All that is there. If we can figure out how to elevate all of this together with bringing health education, not medical education, not about diseases, but about how to be healthy to people, even people in distant areas, outside of the urban areas, globally in Sri Lanka, elevate everybody's understanding of that through whatever the mechanisms that is available, and then put in place structures that continuously educate the population, you can be a regional hub.
Is there a policy sort of like structuring or regulatory support that you think should come from the Sri Lankan government, or could we look at other countries that could help us really structure this for us?
It will be very helpful if it comes from the government, because it will be universally accepted and approved, and it will be way more successful in that respect. You could utilize private sectors in influencing, with the blessing of the government, to improve urban areas and other areas in health education.
You say you are the medicine, and Sri Lanka can be a global or regional hub, at least to begin with, in medical care, holistic approach. But we're also talking about innovations in cardiovascular interventions and innovations. We have a lot of young people who are working on it, and we have Sri Lankans who have gone global, made it big, introduced interventions that have taken the entire world by not just surprise but have been embraced. So Sri Lanka really can. But what can the diaspora community do? Those living abroad, Sri Lankan expatriates who are very accomplished and who are doing very well, do here to help Sri Lanka, help the people of Sri Lanka. You yourself said Sri Lanka is very rich, we have the resources we need, and the other day we had a conversation with a transformational leader in finance, the way we look at finance, the author of Rich Dad, Poor Dad, Robert Kiyosaki, who said Sri Lanka is very rich. So how can we bring everyone together and forget our past to really look at a holistic approach to develop ourselves from within?
Yeah, so Sri Lanka produces, as you said, brilliant minds in medicine. The key is to figuring out how to keep them, and also how to tap into what exists from expatriates to other countries, and how to tap their speciality and their talent and knowledge to benefit the country. It's either through intermittent interactions or continuous relationships that are established with people living abroad, for them to bring the latest innovations and latest techniques, and that is what is available. For example, my institution in the United States, one of the 4 institutions in the country to have studied the second total artificial heart in clinical trials. We were one of the 4 institutions. We did the total artificial heart trial.
The total artificial heart where you transplant?
Not transplanting a human heart, it's a mechanical heart. So you take the heart out of a human being and put a total, completely mechanical heart. It's been possible in the United States, it's possible here, and you tap into those talents, figure out how we can make that happen, and then you have the service here for the population to benefit. So it's all possible. You just have to, one, there should be an intention to do it, second, then a motivation, and third is the financial support and a structure to accomplish it successfully.
I'm just, before we wrap up, reading out some statistics I've got here. As the global market for cardiovascular diseases continue to grow, with an estimated value of $57.3 billion by 2027. Where do you think we stand in terms of contributing to global innovations? We spoke about brilliant minds here, but what's really necessary? Is it AI-supported equipment, or equipment that goes beyond artificial intelligence, or is it something else?
Well, we start with AI from an AI perspective, and then there will be super AI, where AI becoming much more intelligent and creating AI of itself. But more importantly, the resources that's required for the brilliant scientists here to be able to accomplish what needs to be done is the most important part.
I think on that note, it's time we wrap up. But before that, I'll leave it to you to leave a message to our audiences here joining us.
The 3 diseases between 2016 and 2024, high blood pressure, diabetes, and heart disease, has actually doubled in percentage in Sri Lanka. So there is something happening. I want the people to be aware of how rapidly that is changing. In 8 years' time, there has been doubling of these diagnosis of these diseases, which is kind of bothersome to me when I looked at the data. Something to be mindful of, and start looking at the lifestyle, but develop mindfulness and be able to make sure that you enrich your own spirit.
You are the medicine, that's what you say. Thank you very much, Dr. Radha Gopalan, for your time here at Hyde Park. When you visited Sri Lanka for the first time in 35 years, I hope you've been able to travel and visit your family here.
Thank you very much.
The founder of the Healthy Human Institute in Phoenix, in Arizona, in the United States, a heart transplant cardiologist, an acupuncturist, who looks at holistic approach to way we treat our diseases, whether it's preventative care or post care. combination of Western and Eastern medicine. Dr. Radha Gopalan was joining us here at Hyde Park talking about the possibilities of a human being and the possibilities for Sri Lanka to advance in how we approach health and healthcare here in Sri Lanka. We'll be right back with more on our program lineup, but we'll see you again next week with yet another discussion here at Hyde Park. Have a pleasant evening. Good night.